Okay. Das können wir gerne.
Ja, einfach reicht ja auch so. Ne? Bereit? Okay, so good evening, everyone, and thank you for being here. A warm welcome to the Healing Arts Encounters in Arts and Medicine. It's it's wonderful to see you live and online. For those joining for the first time, I see a few. My name is Lukas Feireis. I'm a curator and educator and the founding member of the International Society for Arts and Medicine. And it's a pleasure to host this series. As I mentioned in our opening session last week, the healing arts emerged from a simple but increasingly urgent observation that some of the most relevant questions around health, illness, care, and healing can no longer be meaningfully explored from within a single discipline alone. And before we start, as always, we tie back to last week's session by reading out a few of the students' reflections. And I would like to ask you, Vanessa Weiss, who's the coordinator of the Network for Art and Medicine here at the Charité, to read some of these quotes out to us.
Thank you. Okay, also from our last reflection, we received some ideas or some thoughts that stuck, and there were three that stood out. So the one was, health is not a fixed state, but a constantly shifting individual balance, shaped by an accumulation of factors, not a single cause. The other one was that invisible systems, whether the gut or the uterus, can be made tangible through multisensory artistic practice, touch, material, and form as a way of knowing. And the third one was that art and science are not opposites. Art is a medium through which science can reach and move people. So these three ideas will stay with us as a thread throughout this lecture series. And we are curious to see how we add other layers throughout the series and what we gain from this one today. So let's begin.
And on that note, also thank you, Professor Dr. Anne Berghöfer, for taking care of all these things here at the Charité. Over the past years, the series, actually over the past 3 years, the series has become a space for conversations between artists, between clinicians, between scientists, researchers, and practitioners, not to blur disciplinary boundaries, but to let them sharpen one another. Tonight's conversation brings us into a particularly rich territory because if medicine has historically focused on diagnosing, treating and categorizing the body, the arts often offer another kind of access to lived experience, to ambiguity, to memory, to vulnerability, to perception, and the politics of embodiment. Not as an alternative to medicine, but as another form of knowledge. And tonight we have two remarkable guests whose work meets precisely in that space. Professor Dr. Monika Ankele is Professor of the History of Medicine and Medical Museology here at Charité and Director of the Berlin Museum of Medical History. She's also founding board member of the International Association for Medical and Health Humanities and Artistic Research. Thank you for being here. As a historian, her work focuses on the history of psychiatry, patient perspectives, and the material cultures of medicine. What I particularly appreciate in her work is how it reminds us that medicine is never only scientific or technical, it's also always historical, cultural, and deeply shaped by narratives, by institutions and structures of visibility. Angela Alves brings a very different but equally vital perspective. She's a choreographer, a dancer, and cultural worker whose practice unfolds at the intersection of body, art, illness, and politics. Working from lived experience with a chronic neurological condition, Angela challenges dominant narratives around health, productivity, normalcy, and ability. Her artistic practice foregrounds vulnerability, rest, interruption, and embodied knowledge, not as deficits, but as sites of agency, critique, and transformation. What makes this pairing so compelling is that both ask in different ways whose knowledge counts when we speak about health. Historical knowledge, clinical knowledge, lived knowledge, embodied knowledge, and how might our understanding of care change when we allow these perspectives to genuinely enter into dialogue. Monika is also currently preparing her exhibition Horizontal Politics and Poetics from the Sickbed, opening next week. Here at the Berlin Museum of Medical History, a project that resonates beautifully with many of the questions we may touch on tonight. And as always, we'll begin with 2 short inputs, followed by a moderated conversation and time for your questions. So Monika, Angela, thank you so much for being here. Let's begin. I'd like to ask you, Monika, to start.
Thank you so much, Lucas, for this nice introduction and for these beautiful words that sums up in a way of what we are working on and our research interests. And thank you for being here in this beautiful lecture hall and online. So to start with my presentation, I chose a picture. I don't know what it is or what you would call it. It's should I wait? No. Good. Okay, restart. So the title of my presentation is the title of our exhibition, because that is what what really keeps me occupied at the moment, from day to night and even at night. So I want to take a closer look at this picture that I chose. It's an artistic work by Benoît Pierron. He's a French artist. At the moment, he has an exhibition at the Palais de Tokyo, and he shows one of his artworks in our exhibition that we are opening next Thursday at 7 o'clock at the Lecture Hall Ruin. I will give you more information a little bit later. And I like this kind of work, because it is made from textiles from a hospital. And so it tells us a little bit about the institutional culture of hospitals. But on the other hand, it's very poetic. It has a narrative. It tells us much more than just about the textiles that people are using in the hospital. So this maybe is a good start for my presentation. So I'm not so sure if you know about medical history and that it's a field of history, because I didn't know that something like medical history exists when I finished my studies, when I finished my study of history, when I wrote my diploma. And after the diploma, I applied for a fellowship, and I need a research topic, and I had none. And then I came across a wonderful catalog that is edited by the collection Prinzhorn in Heidelberg, and it's called Künstlerische Interventionen von Frauen in Psychiatrie um 1900. And my sister gave me this catalog and said, do something with it. Maybe it's a research topic for your application. And this was how I stepped into medical history. I don't know if you know the collection Prinzhorn in Heidelberg. It's at the Psychiatric University Clinic in Heidelberg. It's a collection from the 1920s with different works. As a historian, we call them ego documents, works by patients from different psychiatric institutions. And Hans Prinzhorn, a physician and art historian, he collected these works. And it's a wonderful archive because these works tell us so much about art, about the history of psychiatry, about the history of culture and institutional history, so of psychiatric institutions. And I was really fascinated by this book, and I would recommend to all of you to read this wonderful catalog. And this book was full of pictures that really inspired me, and that raised so many questions. And that's how I stepped into the history of medicine. For example, you see here Katharina Detzel. She was a patient in a psychiatric clinic in the early 20th century, and she made this male doll from the bedding that the doctors gave her in the isolation cell. So this is just one of many, many other examples. To work as a medical historian means that you have to look for sources, you have to read them and to research them and to search them. And so we don't just look at objects, but to tell the story of psychiatric institutions, to tell stories from patients' perspectives, you also need patient records. And this is one example, and you see it's quite difficult to read. Every record is written in a different, has a different, it's difficult to read, different Handschriften. The handwriting has different handwritings. That's it, thank you. And but these patient records are full of very detailed information about how patients lived in the early 20th century in psychiatric institutions. So they are very, very rich sources for really to get a feeling about this time and about daily life in psychiatric institutions. And so I started this research, and I finished my thesis with a book about everyday life and appropriation in psychiatry around 1900. And I just looked at artworks, at letters, at objects that female patients left behind. And I still work on this. So the history of psychiatry, the patient's history is still something that I'm completely into. So, and after my thesis, there were up to now some central research questions. And these research questions are also very important for our exhibition on horizontality and about the sickbed. So how do objects shape our understanding of medical history? How do objects influence institutional medical cultures and the encounter between physicians, nurses, and patients? So, for example, when you look at this bed is like it tells us something about the relationship of patients and physicians. Who is the one who is lying down? Who is the one who is standing upright? And this tells us about power relations in medicine. And it's a very simple, a very daily object, but there's so much more information in this object when you think about people that are working in a way with these objects of medicine. And what can the material culture of medical institutions reveal about patients' perspectives? So, for example, when we go back to Katharina Detzel, she used this bedding for making a doll. So this is a perspective that I'm interested in my research. And how can we unfold the poetic and political dimensions of historical sources? And I'm very much interested in the poetic dimensions, and that's why I appreciate so much to work with artists and artist researchers like Angela Alves or other artists. So in 2020, I organized an interdisciplinary conference where I invited artists and scientists to think about material cultures of psychiatry. And this is the book that I edited together with Benoît Macharu. He's a historian from Luxembourg. And this was really a fruitful conference because everyone was dealing with an object of psychiatric institutions, but the approaches were so different and so inspiring and so rich. So some, for example, this is the contribution of Kai Sammet. He was thinking about architecture and how architecture determines relationships in psychiatries. Viviane Stopp, she was a student at the Hochschule für Künste im sozialen Ottersberg. She was part of a student project as part of the conference, and she drew significant objects of psychiatries, because when we think on the history of psychiatry, we may think on the straitjacket, and she drew these objects in a very sensitive way. And I had a research project that focuses on two objects of psychiatry, and this was, and still is maybe, the bed and the bathtub. As Angela will also refer to these objects, and you will hear about this a little bit later. On the one hand, I was interested how the bed and the bath, how these treatments were installed in psychiatry, how psychiatric institutions changed when these two treatments were in practice. So you see on the left hand, this is a psychiatric ward where the patients lie in bed, and this was at the time of around 1900 a new treatment, because before that time patients were put to isolation cells when they were restless, and around 1900 this changed, and people were put to bed, and they should stay in bed until they calm down, and after that they should start to work and go out for a walk a little bit and so on. And the other treatment method was to put patients in the water, and they should stay there also until they calm down. So these were two very, very prominent treatment methods around 1900. And I was interested how these treatment methods changed the daily life in institutions, how they changed the encounter between patients and nurses and doctors. And I was also very much interested how patients experienced these treatment methods and what they wrote about it, what they think about it. And you can imagine this is quite difficult to find out, because usually we collect very prominent things that doctors left behind, but museums usually don't collect things that patients left behind, because they're not important enough, as they saw for a long time. But here are two drawings made by patients, and one drawing is by Franziska M., and she sketched the observation ward, and you can see what is the dominant thing in this drawing. It's the bed. So you see beds on the left and on the right. I think maybe on the back these are windows, and then you have the desk and the chairs. And on the other side, you have a drawing by Bernhard B. And it's a great drawing because he drew himself while lying down. He just drew what he saw, so his legs, and you see that he is looking out the door, and it's a very vibrant drawing. It's really yeah, it's beautiful. And that gives us an idea of maybe how patients perceived their lives in psychiatry. And also this drawing by Maria Poot, we can call her name. She's also already on Wikipedia, and she drew this in the permanent pass, so in the Dauerbad, it's called in Germany. And the doctors noted that this is drawn in the permanent pass. This was the command of the doctors. And this is it's not a drawing, it's an object that a male patient created. It's a handmade doll, also made of bedding, and it was published in a teaching book by Wilhelm Weigand, Atlas und Grundriss der Psychiatrie. And for Weigand, this object was like a proof that this man is crazy. He's a maniacus because he did this thing. But when you think, for example, on Franz West, the artist with his objects, it's a little bit similar. Yeah, this is the exhibition that we're opening next week. This is our poster. And this is what the exhibition is about. The exhibition explores how perception and our connection to the world change when the bed becomes the center of our lives. Historical objects and archival materials, artworks, activist positions, and stories of lived experience enter into a conversation that stretches from the 19th century to the present. This allows a richly varied picture to emerge that shows the sickbed not only as a site of medical treatment, but also as a space in which fundamental issues of our time emerge: participation, care, solidarity, and the conditions of rest in an exhausted society. And the pictures above are from a book by Karl Baumgärtner. He was a physician, and the drawings are by Karl Friedrich Sandhas. And he drew patients with different diseases. And the idea was that students should learn how what the disease look like when they look at these drawings. So to see how to see. And the interesting thing is that Karl Friedrich Sandhas, he later became ill, and he was for a long time a patient in a psychiatric institution. And I really like these pictures, and they are, since yesterday, they are in our exhibition already. And this is just, these are different insights into what we will show in our exhibition. So we will bring all kind of material, historical material, artworks by artists with chronic illnesses for whom the bed is living and working space. And we, of course, will focus on the history of medicine and on the meaning that the sickbed had for the development of modern medicine in the 19th century and up to now. And I think we can talk about this later, because I think when I look at, I'm done. So because, this is a good connection to you, Angela. It's an article that we published last year, and it's about lying in. It was a conversation from the bedside, and Angela will talk a little bit also about this article, maybe, or not. We can do it later, yeah. Yes. There's the book, yeah. No. Okay, thank you so much.
sehen schon. Ja. Ah, und das ist das Ding hier, ne? Mit dem. Okay. Yeah. Hi, welcome. And thank you for being here. Thank you for having me. I'm gonna directly go into the thing because time is limited. And I was asked to create slides with my presentation, and that's always tempting for me to accumulate and open this door and that door and this door and that door. So I'm gonna try a little bit more speedy presentation. I chose this slide as a starter because I wasn't sure if I would be the first one or not. And then, you know, it's always a little bit awkward if, you know, a slide is already waiting before the event is started. So I chose it because it's visually interesting, but it's also the title of an ongoing research that I'm doing within my role as an artistic associator at the UDK Inter-University Center for Dance. It's very complicated word, but the German term is even more complicated. So I am an artist, but I am also a researcher. Like, I would say 99% of my colleagues. And I wanted to drop this information right in the beginning because I think it's a good way to soften or even to queer the binarity between science and arts. And yes, as I said today, I'm not going to share this wider research with you, but maybe I'm going to choose two tentacles of this creature. And yeah, so the title is a little bit complex. It's called Cripping Nervous Systems, How to Dance with Stressed Cultures. But in the end, you can also boil it down to just one question. And the question is, how can I work sick and stay healthy? This is actually where it all comes from. Like, this is my main question, which is under or on the, how to say, on the ground of everything that I'm doing. So yeah, my name is Alves. I am a dancer and choreographer, and my central nervous system gets inflamed from time to time. And that's why I rest and quit a lot. And because of this, resting and quitting are the two main practices that inform and shape my artistic work, my teaching, and my research. So we go and have a look at some artwork. This work is called Rest, and it is an audio installation, but it's also a performance or a performative audio installation, because there are bodies included. What you are looking at is a bed. This has been my private bed, and some audience members lying inside of the bed. Oh, yeah. Of course, this is what always happens. Like, I'm breaking something. I'm going to use this. Yeah. So, okay, how this work has been created. First, it has been created in 2019, just before Corona kicked in. So at this time, it was still possible to have visitors in your bed. So this is what I did. I invited 3 women who experience chronic pain into my bed, and we would have conversations in my bed on their relation to rest and to their own bed. And I recorded these conversations and then I edited them. So in the end, it would be an audio. And then I kind of surgically implemented these conversations into the inside of the mattresses by using a couple of loudspeakers. So as an audience member, you would be forced to lie down in this bed in order to be able to listen to the conversations, right? So you would have to put your ear onto the mattress and then you could listen to the conversations. And of course, I mean, what a surprise. What all of the 3 conversations revealed is that rest is something that is deeply rooted and connected with emotions of guilt and shame. But yeah, what's interesting here is first, like 2 things is like the body of the audience is also covering the body of the performer. So this would also be a work that I can send to a theater if I am not available. So it's actually an access work for me. And then the second thing is that the audience members, the body of the audience member is a body that is forced to lie down. And we are going to meet this body later, maybe, when we talk about medical and cultural history. I need to press here, right? Oh, here, yeah. This is the same work, just another place. And actually, it's a little bit of a translation of the work, but just to show you that it's not the bed that is the core of the work. Is really the conversations of the women. So this is not my private bed because this happened in Serbia, in Novi Sad, in the gallery of Matica Srpska in 2022. And what we did is we translated the conversations into Serbian, and then we produced a transcript that has been projected on the ceiling. So here the audience member would have to lie down flat on their back in order to be able to understand the conversation. And yeah. So my professional background lies in dance. I'm a dancer. I studied dance and actually also dance theory. But I'm also living with a chronic inflammatory neurological condition. So I am also an expert in this area. And since today we are gathering here in a very medical environment with such an important history, such an important legacy and power, I would like to take you with me to another level, to another tentacle that I'm interested in. And this is the intersection between performance art and medicine / medical humanities. And for this, I want to share an anecdote from a real life situation in the medical system that I just experienced like 1 week ago. So where are we? We are at my neurologist's treatment room. And of course, this is a lie. This is not my neurologist and this is not her treating room. But I asked AI to produce a photo for me. And I wasn't really happy with this one. I thought I didn't like how these persons appear, and I asked AI to produce another one with a more modern and Berlin-like look. And this is what I got. So I take you into the situation now. So after I recently had to stop taking a new MS medication due to poor liver function test results, this is when I saw my neurologist for the first time after I had to stop. And I wanted to talk about the side effects. The side effects that I was still experiencing. And by this, I mean, you know, the pain that came with the medication and that you cannot see if you only look at the paper showing the blood test results. So I shared this with her, and then she explained me that such sensitive reactions to medications were typical of dancers, and that one could tell just how vulnerable I was simply from my very graceful body language. So if we want to know where art can add something to medical science, pain, and especially chronic pain, would definitely be an important aspect. So specifically, the pain that exists beyond medical records. This can be a very concrete physical pain, and it can also be a pain caused by medical myths. Like the myth that dancers are more vulnerable and more likely to experience side effects. Which brings us to the next slide. So art gives us the opportunity to not only talk about pain, but also talk about problematic medical storytelling of bodies. I mean, just to be clear, I think it is a myth, right? I mean, correct me if I'm wrong. I think it is a myth that dancers are more vulnerable to medication than non-dancers. At least I couldn't find any research on this. I chose this anecdote, this example, because it's really a sweet one. And it is like, it comes with no bad intention at all, but still it shows that myths are living in the medical system. Some of them appear to be harmless, and some of them are problematic. And they all don't just appear out of thin air. They have a history in the past, but they also have a legacy in the future. You know what? We will skip this one because of time. And this is actually just scientific evidence of what I said. So let's just jump into the next project, which has been created in collaboration with Monika Ankele and the Medical Historical Museum, of course. So this project took off after I decided to work from the bathtub. The bathtub itself has been a very important place for me for crip care. And I wanted to work from there. And then I found out about Monika's research on the Dauerbad therapy. Dauerbad therapy, continuous bath therapy. So the Dauerbad therapy has been a common psychiatric treatment in the end of the 19th century until the middle of the 20th century. And when I learned about the concept of the therapy, which is basically lying in water for hours and days and weeks and months, sometimes even overnight. When I learned about this, I was let's say, like, my emotional body was dancing. Yeah, like I couldn't believe it. I was really like fascinated, but also angry and very thankful for this knowledge. Because before we worked with the bath, we also worked with the bed together. And I didn't know that Monika was researching the bed and the bath. So we both went from the bed into the bath. Yeah, and I also have this these wonderful photographs showing patients in a Dauerbad therapy situation. But I mean, we also talked about this. These are, yeah, 5. Danke. 5 ist super. So I thought, when I found out that actually all we know about the Dauerbad therapy, we know from the perspective of the medical system, except of some drawings that we have found in the patient's records. And I took it from there because I thought if the Dauerbad therapy is going to be retold for the present and for the future, it must be from the patient's perspective. So I again invited chronically ill women into my bathtub, this time not into my bed, but into my bathtub for bathing together. And we took with us some drawings from patients from the Dauerbad therapy, like this one. This one was specifically inspiring me because, as you see, it shows 2 persons in the same bath. And of course, I mean, I think it was just an imagination. It was not happening. So I thought we are gonna do this for Elisabeth Faulhaber. And I also brought a snippet from this work, like one bath with Daniela Droscher, who is an author and just released a book, which is also interesting, but we don't have time to look at this now. Maybe we have time to look at it later, I don't know. And the collaboration with the Medical Historical Museum, I was very grateful to have to be able to get some of the jaws, preparation jaws. I don't know, preparation jaws. Yes, but you know, I forgot to look up the English term for it. But yeah, you see what it is. And the big one in the back, it's very old. it's still from the time when Virchow was founding actually this pathologic anatomic collection. And I collected the bathwater from the conversations, and I filled the bathwater in the jars. And now the water and the conversations and the jars are part of the exhibition that we did together. And you can all visit this exhibition until autumn 2027 or something. Yeah, it's amazing. This is a QR code. You can take a picture if you want. It's gonna lead you to a website with a little bit more details, and you can also listen to some of the conversations there. And this, just shortly to finish, this is a small performance project that I'm gonna do, and you can, it's gonna happen next month, the 20th, 21st and 19th of June at Sophiensäle, where I was invited to create a historical house tour and search. I was searching there for traces about sleeping and resting under force and control, or under oppressive, in an oppressive environment. Okay. Yeah.
Yeah, I go on the patient back. Yes. You too. Take the chair.
Or just sit.
Am I visible if I would lay down?
I can adjust the camera.
Maybe change the questions.
Yes. I would love that idea, actually. So thank you. Thank you both very much for the presentations. There's obviously a lot of common denominators. That's why also you work on so many projects. I have a few, like say, question clusters. The first one, since you started, Monika, that I'm curious about is the idea of the material cultures, like everyday objects within clinical contexts, that they are not only treatment methods, but that they're also carriers and maybe conveyors of meaning, individual, social, medical, cultural, societal, and poetical. And you had a quote at the very end that said something like, the bed is like the ultimate symbol of illness or sickness or something like that. But it's also what came to me, the symbol of intimacy. No, the bed is like our private space. And I mean, I'm laying here now, but this is not probably the online audience. Maybe half of them are laying down right now, and maybe even in their bed. Because there was, I remember already maybe 10, 15 years ago, an article in New York Times, pre-COVID, where they stated that most young individuals that work in New York City, 80% of them do it from within the bed. So the bed has changed, not only within the clinical context, but also in our general life. No, it's become you called it also living in a working place. Yeah, so I'm trying to get these things together. And I also thought of, obviously, Yoko Ono and John Lennon and the bed piece, where there's a clear statement to do it from the bed. I thought of Beatrice Colomina, who is an architectural historian who wrote a book on the century of the bed, that the role of the bed has changed. So maybe I throw this just as food for thought into the ring and see what comes to your mind.
Yeah, I was thinking about Frida Kahlo because we are showing two photographs, one by Juan Guzman and another from, I forgot his name, two pictures that show Frida Kahlo, the artist, in that's happening. It's like a Greek symposium when you're lying here and we're talking about the bed. And these two photographs show Frida Kahlo in her hospital bed. And they're so amazing, the photos, because she had an installation that helped her to paint while lying down. And she wasn't allowed to move, not even to move her head up. And so she lay completely flat in the hospital bed, and then she painted this phenomenal paintings, pictures, and we showed 2 pictures, and we are so proud of that because it was really complicated to do this with this Mexican archive. And for Frida Kahlo, the bed was, I mean, she suffered from polio when she was 6. Then she had this accident with the bus, and she had a lot of operations. She had a lot of pain, but she's an icon in the context of crip art and disability art. And it's yes, and for her, the bed, she managed it, that the bed was not just the place where she suffered, but was the place where she created an own universe with her pictures, with her paintings. And she also designed her bed. She had a mirror in her Himmelbett up there, so she could see herself and paint herself. And I think it was last year when the painting La Cama, the bed, was sold for I don't know how many dollars. And it's the painting that there was never a painting that was sold at that price by a women artist. And this is not so important for our exhibition, but it's also a story that came in my mind when you had your thoughts. And what we are doing in our exhibition is to really to look at the traces in the history of medicine, and look at patients' histories. And it's easier to do it in the present, but it's so difficult to do it in the past. But it's so important to do it because this is the only way we can really bring in different perspectives. And this is what we really like to do with the exhibition. I mean, if I come a little bit closer to you, I would stand now and I would look down at you, and you just by this, how we encounter each other, you lying down, I'm standing upright. This is a power relation. And there's so many important aspects inscribed in this encounter, and we really want to turn this around and to give you a voice from the lying position, and to make this visible, and also to make visible, and then I quit, and also to make visible that we are here at the Charité campus, and the Charité is so well known for medical research and for really outstanding medical research, but there's no history about the social, how should I say, I don't even know the word now in German, Versorgung, like the care, yes. Health, yeah, but the social care. And so because nobody knows, or you don't read it in books, that, for example, at the Charité, at the end of the 1920s, there was a broadcast installed. So the people had, the patients were able to listen to the radio, and the archives, we found letters from the clinics where they say, our patients are so bored, they need distraction. So please give us a loudspeaker, please give us headphones for them so that they get distracted and that they have entertainment. And we found also letters by patients where patients wrote, we need to hear this because we are patients, but we are still part of the society, and we have the right to participate, and that's why we need to listen to the radio. So this is also a part that we show, and this is also so important to show. It's medical care, but it's also social care. Patients' libraries is also an example.
Do you want to add something to this, Angela? Otherwise, I have a connecting question that could lead to you. Yeah? Okay. No, because you just mentioned all the important things, the narratives of illness, of vulnerability, and the visibility of things. And in the last artwork that you showed with the water from the bath, the subtitle was, I wrote it down, where are the patient's perspectives today? Which brings the question you had just raised back into the room. And I was thinking, since illness is never only biological, it's also narrated through language, through institutions, even through objects, as we learned, and family system, culture, etc. Who gets to shape these narratives? And maybe I'm wondering now, hearing both of you, if illness can become somehow a side of authorship rather than only diagnosis. And I'm curious, Angela, now, from your experience, from both sides, and also thank you for your clinical anecdote, like maybe starting with what has frustrated you the most so far in this like lacking of the patient's perspectives, or the illness as a, I think it's a nice formulation actually, illness as a side of authorship rather than diagnosis.
Oh yeah.
Where to start?
Yeah, it's a complicated question. It's like, because I got my diagnosis in 2008, so it's a long time ago. I have a long journey, and I mean, there is an evolution going on in that is linked to identity. Because what happens when you first get a diagnosis that is, you know, a serious sounding disease, because my diagnosis is labeled. Every diagnosis has an own label, and when you first meet a diagnosis and you sit next to the doctor, and the doctor tells you that this is your diagnosis, and then you start to build your own identity around this diagnosis, and you start to speak about my diagnosis. Many people do this, and I did this for a couple of years, and then I questioned this. So it has been living, like going into the diagnosis, understanding the like how it works, going into the medical knowledge, and trying to find like also images. Like if you have a sick central nervous system or a sick nervous system, it's very hard to get a picture, and you need a picture. Like I needed a picture. I was visualizing nervous systems for a long time, and it's tricky because the nervous system is not living without water. Like it is not living without the body, the rest of the body. So I was then working with images like trees or Quallen jelly, jellyfishes, and so on. And then slowly I also learned more about disability justice and the different models of disability. Like then I started to identify as a disabled person, which has been maybe the next step, because I never saw myself as disabled, because my neurologist told me, if you don't take medicine, one day you will be disabled. And then so it's a completely different understanding, because disability is not only like, it's a medical model of disability that is linking disability with your body. So seeing the disability and the illness in your body is not only dangerous, like psychologically dangerous, but it's also not true, and like seen from the political perspective, like it's basically a lie, because if you look up how disability as a concept is defined by law, for example, it's different. It says that this, like it's a combination of having an impairment and the environment and environmental. So this all both together is creating disability. And I could go on now for a long time, because then, you know, after identifying as disabled, I identified as CRIP, and now I would say I don't even, you know, I don't, it doesn't matter to me if people know the diagnosis, but I don't like to share it or to put it in the front or in the center of my thinking, because it's limiting, and it's I forgot what I wanted to say. Yeah, because it's representing the medical model of disability, and especially because I'm also an artist, and sometimes people like want to talk to me about a dancer having MS. Like, this is sensational, right? Like, people want to talk, oh, this poor person, like a dancer with MS. Like, this is so interesting so I didn't want to do that no more.
Yeah, thank you. Thank you also for the openness and the vulnerability in the room. Maybe before we come to the topic that you brought in as the lived body and the medical body, I think that's an interesting one for us. Coming back to these narratives and authorship, like, do you have examples of patients in your research that were kind of allowed to own their authorship? That were allowed. On the authorship of the illness.
So the history.
Can you find any examples? Because you mentioned before, most of the notes that you have are obviously from the practitioners, from the clinicians, not really from the patients. At least 100 years ago, this has changed, you said in your talk. So I would be curious to hear of some examples where the patients claimed authorship over their own stories.
Yeah, I mean, this, you find this also the stories that were collected by the physicians in the early 20th century, but it was never interpreted like this. It was interpreted for example, when you think about in psychiatry, patients write a lot of letters because they want to tell something, they want to get heard, and you can read these letters in two ways. You can read it from the medical perspective as a proof of their illness, or you can read it as the expression of a very special need, or as their own stories. And so I think there's not like. So what has changed in the history of medicine is that these sources are now differently read. So, or even that people or that historians look at these sources, or but this is not the answer. This is not the answer.
It's contextualizing. It's contextualizing the answer to my question. My question is: do you have examples where kind of patients they claimed authorship over their own stories? The beautiful example that Angela gave. Here's your diagnosis, and then actually you gave an example for that. No, first she took that diagnosis, and now, as I understood, you own your own story.
Yeah. I mean, we have this. I'm so into this exhibition. One example more from the exhibition.
Yeah, wonderful.
For example, we show the story of Johannes Messerschmidt, and he's a disability activist in Munich, and he was born in the 1950s and then got polio, and he lived as a child for 11 years at the intensive care unit, and after 11 years, two students came and said, we can help you to get out of the intensive care unit. Wir beatmen dich, so we help you to breathe. And then he could leave the intensive care unit for a few moments, and the next step was that he could leave the intensive care unit, and he started to live in a shared apartment. And the story goes on. And now he's a disability activist, and he is really he tells his story and he owns his story. And this story is so heavy and it's so beautiful and it's so important that he shares his story with us. And he will also come to the exhibition, and he's so he gave us for the exhibition little photos that show him at the intensive care unit as a child and surrounded by friends and families that celebrate his birthday there. And Lea Münch, a medical historian, he did an interview with him, and he explained, for example, how he used a little Spatel.
Asparagus?
Yes, very good. He used this to move little toys at his side. So he could move a little bit his head. He couldn't move at all, but he could move his head a little bit, and he could play with these figures. And it's so important for him that he's not a sufferer of his illness, but that this is his life. And I'm really happy that we have this story in the exhibition. I mean, Frida Kahlo, we all know her, and it's outstanding, and of course it's a great story, but I'm very much interested in these other stories that have not been told yet.
That's the perfect answer to the questionnaires.
Yeah.
So I have another question, but then maybe from the audience there's questions as well. But I lead into one more, and then I go around with the mic while you guys can answer. And that's what you also just brought up, Angela. And that's what I noted as the lived body versus the medical body. So yes, obviously, medicine has historically developed very powerful ways of seeing and classifying and treating the body. But the lived bodily experience often extends those frameworks, medical frameworks. And where do you both, from your experience, see the biggest gaps between the body as a medically understood and the body as actually lived?
Can I start?
While you ask this, I'll walk around.
Okay, how to put that? I believe, and that's already wrong, like it's already the wrong word. It's not that I believe, but I am sure, I think this is knowledge, that medicine is missing the whole internal world of the body. And we don't have language for this. We don't have language around pain. We don't have language around embodiment. The medical gaze looks at the body as a machine. Like it looks at the body as something that can be fixed. It fragmentizes the body into little pieces of a machine. And if these pieces are, quite okay, sometimes you can even, the machine can work without, like with missing one piece. And then you have to rebuild this machine, and then it's working. And I can't understand why medicine is like neglecting embodiment. I mean, it's even hard to speak about it because there's so much stigma around this topic. It's but there is research. I mean, there is medical research. It's not that, you know, it's all esoteric or, you know, but it's this whole inner world is something that I rediscovered. I would say I rediscovered, because I know this word from when I was a child. And we all know this world from when we were children. And when you are in chronic pain, when you are experiencing chronic pain, then I think you rediscover this world. And this is, for me, like this, for instance, in resting as a practice, for me is so important to think about. It's not distraction. It's not lying down on the sofa with your mobile phone and directing your perception to the outside, but it's directing your perception to the inside, and really, you know, this sensing and just be with yourself. I mean, you can also call it meditation, but this is too much. It's just rest. It's nothing more. And I would say this is the most important thing medicine is missing out.
I'm thinking, I think for me it's difficult if we speak about medicine as a subject, because there are always people that do medicine. So there are human beings that gain this knowledge and that encounter people that are in pain. And I think this, so that makes it for me a little bit difficult to say this is medicine and it's bad. Also, I totally understand, and I'm on yours. I go with this, what you say, but I have to think a little bit about the history of medical humanities. And in the medical humanities, when they started and still up to now, it's still the bad medicine and the good humanities. And I'm not so sure about this constellation. Maybe this is enough. Yeah.
May I come back to the bed? First of all, I think this is a nice situation how you are sitting there and handling the bed, because normally in Germany, as a patient, you are not allowed to move your bed. You are not allowed to turn around your bed, for example, to look out of the window, or because you want to look into another direction after lying there 3 weeks or so. Yeah, but so this kind of freedom, I think the bed is. It's a bit provoking now, perhaps, yeah. But I think the bed in the medicine is also a little bit a symbol of the was ist Gefängnis? A kind of prison, of imprisoning patients, yeah, people, and of exerting power against persons, yeah. So you have already mentioned the discrepancy between the staff working in a hospital, standing, looking down onto the patient. And I need to say that there are only a handful countries in the world that have more beds, of course, in relation to the size of the population, than Germany. And many patients in Germany are not necessary to be kept in bed. They are kept in bed to, of course, get money, and on the other hand, to, yeah, some kind of imprison them. Yeah, because then you can, decide without giving them a chance to participate or so. Yeah. And I think this perspective on the bed as some kind of imprisoning instrument is completely left out in the German healthcare system, and in many other healthcare systems probably also. Yeah, but if you go to other countries in Europe, they have a third of the hospital beds of Germany. Yeah, and nobody needs, for example, a mother who got a child it's not necessary that she lies in bed. She is in a kind of mother hotel, yeah, and she can go to a catering buffet if she's hungry. She needn't be served by this plastic, this plastic tablets with, yeah, all this stuff. So I think what I would like very much if artists could catch up this perspective of this negative perspective of the bed in the healthcare system. I would very much like it. So this was provoking, and maybe you have a different experience, or I think different on this. And also perhaps in the chat someone is answering. Okay.
I think it's the ambivalence of the bed. It has so many aspects. And in history of psychiatry, physicians they were really talking about that they need a bed, that patients need to be put to bed, because otherwise they don't understand that they are ill. Because we have this association with lying down and being ill. And so this was really a discussion in the 19th century, at the end of the 19th century, why to use the bed and why to introduce bed treatment in psychiatry. Because if you break your leg, you feel it and you know there's something you have to do. But if you get a psychiatric diagnosis, you're not really convinced that you're ill. And so the bed was also a method to convince patients. Yes, in a way. Yeah.
Yeah, first of all, thank you very much for both of your talks. I found it super interesting. And there are a few things that stuck with me. And one thing was the Dauerbad therapy. And in relation to the bed, you talked also about the bed being so loaded with shame and guilt right now, like even in a museum surrounding, going into a horizontal position feels weird. And also you stood up from the bed from time to time within this talk. So there's something that also confers meaning and make us react in a certain way. And I'm interested because also at the beginning, before the talk started, I think you, Monika, said something about laying down horizontal changes your style of thinking or your thinking in general. And being in a Dauerbad also makes you, it's such a even more vulnerable state because you're probably naked in this bath and you're there for such a long time. And also this connection of being in water, maybe also being in water as an embryo. Did you find out read you something about how the perception of these patients were changed by being in a bath tube, also exposed to other people being in clothes after such a long time?
There are a few documents, but the idea of the doctors was really that the patients should feel ashamed, and because they would feel ashamed if they leave the bath naked, that's why they would stay in baths, for example. And there are some documents, like in the patient records, when they quote some things of the patients, but it's really very different. There are patients that really enjoy being in the bath. They do everything there. They are smoking and reading and writing, and others get really much more nervous than they was before they were put to the bath. So you can't really say it's that way or the other. It really depends, and these are all the things that I find in the patient records are really short quotes. So you really have to go so much in the detail, and you have to make these little quotes so much bigger and put it in a context and give it a sense. So it's really difficult. But like, because you mentioned also this change of perception, or I mentioned it, that when you lay down, you perceive the word differently and you think differently. Maybe you know the essay by Virginia Woolf on being ill, and she really describes it so beautifully, how the perception changes when you lay down. And she says that so we are all like, the uprights are like in an army. Every day they go out and they do their things. But when you lay yourself down, you suddenly look at the sky. And then she writes, it's a spectacle. Someone has to write to the Times because it's so overwhelming what is happening there. And this is it's beautiful written, and it's a recommendation.
I think it all depends on the situation, like in being put into the bathtub and being put there because and tell it as a form of punishment, because this is what it has been. Like it was not mean, like the psychiatrist would tell you, you know what, you look like if you would like to go into the bathtub and have a nice time. If you would be too emotional, too aroused, too loud, you would go there. And even like, if I understood it right, you first would go into the bed and stay there, and then if this is not helping, like second, the bathtub would be the second level. So because this is more intense. But of course, I would say, like for me, the bathtub is like a bathing is happening in a super safe environment, because the private bathroom, like I'm also a mother, and this has been the space where I would close the door and I would tell my kids, I'm taking a bath now, and then I won't get disturbed. Because if you just say, I'm going into the bath, they will knock on the door. Like, okay, it's going to take 2 minutes. And then, but they would know, Mama is now taking a bath, so we don't go into stuff. So, and this has done something with me. And then I can also enjoy, because it's warm water, and it's like, it's like a hug. It's like receiving a hug. And for me, it was always connected to be to have access to another cognitive state of being. It would be easier for me to think and to finish my thing. And I would talk to myself sitting, being in the bath. This is why I initially wanted to work from there. Yeah.
Thank you. It's amazing. Know how we, after this talk, will definitely feel very different when we lay in bed tonight, or we might even take a bath. Know how like objects of everyday change once you hear the story, and so it goes for everything. Maybe as the final question, and I'd like to kind of end with a question. You have collaborated before, but each other talk tonight. What's the one thing that you have learned from one another? Yeah. You want to start?
Of course. I mean, of course, I learned a lot. I mean,
doesn't have to be a long, just like one short thing that comes to mind.
I have one short thing that comes to mind.
I really love to work with Monika, and I also love to work with Celine. There is actually a third person also included in this little group, and I so much appreciated our talks. And I felt really seen and heard, and I felt that we had a very democratic exchange, and of course I learned so much about the history, the psychiatric history. I have been, like, through Monika, became interested in that topic, and I'm super thankful for learning about the Dauerbad-Therapie and the bad therapy, and our collaboration is really somehow the foundation of the research that I'm now doing. Yeah, you want to have this book just to get a feeling.
Yes, and I mean, I can give it back to you. It's really such an inspiring collaboration, and for me, it was so. I really love Angela's the freshness of her ideas and how she approaches the things that I'm talking about, the history, and it's for me, it's sometimes so weird also what I do. And then there is someone who takes this up and makes something out of it. And it's such a wonderful work. And this is so, and it was so great when we met and Angela did this, her work on rest, and to see that there is a connection between the historical things and historical research, and it has a meaning for the present, and how you deal with it, and how you and the language that you chose. So it's really great, and it really motivated me to be open to artistic research.
Thank you so much, the both of you. Thank you for being here and for experiencing, again, different ways of knowledge here. One thing that came to mind, maybe as a closing word, and I have to paraphrase it, but a few years ago, Susanne Pfeffer curated an exhibition called Time at the MMK, the Museum for Moderne Kunst in Frankfurt. And there was something like the opening phrase was something, you don't need to be fixed, my queens. It's the world that needs fixing. Maybe that's a nice closing word for us tonight. Thank you so much.
Thank you so much. Thank you.
So yeah, and for the online audience and for actually the audience also here, and our next session will be on the 3rd of June. It's going to be in this space. Yeah, it's going to be in this space, Paul-Ehrlich-Saal at the Charité. And it's going to be an interesting getting together of Dr. Ivan Neshev and the artistic duo Kennedy and Swan. So save the date and see you then.